Thanks for the opportunity to present some thoughts on this issue, which I've been thinking about for a while, but I haven't quite managed to write a paper on it for different reasons. And it's great, but also a bit intimidating to see big experts in SGEI regulation in the audience. I'm sure we're going to have a very interesting Q&A later. The idea today is just to share some thoughts on what can be done, if anything, to try to regulate procurement for healthcare as a service of general economic interest, basically with the aim of shielding it from compliance with EU competition and state aid rules. And this is a very clear strategic interest that the UK has pursued quite openly, especially in March 2019 with a specific entrustment letter that was sort of designed to tick all of the boxes of the EU regulatory framework to try to shield a new entity from having to comply with state aid law in particular. And the purpose is just to use this as a case study to look through the framework and how it applies to this specific decision in the English context. But then, of course, hopefully it's going to trigger some issues that are of broader interest or interpretation and in other jurisdictions or for the future. I think Mary rightly raised that it's now something of an oddity to talk about EU law in the context of the UK, given where we are and the uncertainties ahead. But I think that this may be an issue in other countries trying to replicate a similar model. So just to give you a broad budget overview of how healthcare procurement works in England, because it's not as it works in other jurisdictions, I think we need to distinguish two tiers of procurement or contracting for the purpose of the NHS in England. And this is due to the fact that, as many of you will know, there is a so-called internal market in the NHS in England. So this is a structure whereby some entities are in charge of deciding which health services should be provided and funded, but they don't provide them. This is the usually called clinical commissioning groups. And then there are entities still within the NHS tasked with providing these services, and that would be mainly NHS trusts. And they enter into contracts for this. But this level of contracting, I would call it purchasing of care. So the CCG is buying services from the NHS providers. And this is subjected to procurement rules of a complicated nature, and there's a bit of an overlap, and I don't want to talk about that today. What I want to concentrate on is when the NHS provider, the hospital, is buying things that they need, and it's been very clear now, for example, when they need to buy PPE or when they need to buy a new machine, like ventilators or anything like that. So that's the dimension in which I'm going to be concentrating. The purchase mainly of supplies and a little bit of services for the purposes of providing healthcare services. And that's what I call purchase for care. And of course, there can be some procurement of care, particularly if there is health services being contracted to a private provider, and there's been a lot of that in the context of the COVID pandemic. But this is something that, for example, Mary has been talking about and writing about. So I will also ignore that. So for our purposes, procurement is, let's imagine just the simple example of trying to buy PPE for hospitals in England. Now, this used to be done by each hospital as they need it with their own budget. But in 2015, there's a big influential report called the Lord Carter Review that identified very big divergences in prices across hospitals. And they thought that a more centralized, more coordinated approach could yield very big savings and financial advantages. So from then onwards, they created an entity called NHS Supply Chain that initially was actually only a contract with DHL for the provision of logistics services and wholesale buying and reselling of supplies for hospitals. But then in 2018, it changed, and they created this new operating model that you have on your screen that is meant to be quite intuitive, but I always struggle with it. What they did is that they divided the supplies in 11 towers. They call it towers. And they tendered one contract for the management of each of the towers. So the model is based, as we can see in the next slide, on a very long number of contracts. Where, just to give you an example, so if we're looking at the ward-based consumables, which is the top category, which for example would be PPE, that's a contract that is awarded to DHL, but that doesn't mean that DHL is supplying the goods. What DHL is doing is acting as what's called category tower service provider. So what they're doing is that they're designing the strategy on how to procure those consumables and putting in place frameworks for those consumables to be operative. And at the higher level, the coordination of all of these 11 towers is under what's strictly speaking called the NHS Supply Chain. And in particular, there is one entity that is called Supply Chain Coordination Limited, or SCCL, that is an arm's length entity that eventually belongs to the Department of Health and Social Care through different roundabout ways. So what I want to concentrate is on the funding for this entity. The remit of this entity, and this is something we're going to discuss later, is fundamentally to manage all of this network of contracts. And the main aim of that management is to create savings for the NHS. So they want to create savings in excess, I think, of £600 million a year. And the question then becomes whether this system to create this savings can be self-funded or needs to be funded in a different way. And that's where the issue of crafting it as a service of general economic interest, and in particular the state aid rules applicable to them, is going to be crucial. So to narrow down the topic very, very quickly, it's just about how does the entity that is aimed to coordinate a network of contracts for the supply of things to NHS hospitals fund it. And it used to be initially, from 2015, that the funding was coming from those savings. So fundamentally, SCCL, or it's the previous incarnation of that entity, was funded by the savings it created. So it would buy at a price and sell to the NHS trusts at a different price, and that markup was part of its funding. And it would also get rebates from the suppliers within the frameworks at the end of every term or every year. So basically there was two funding streams. One, the difference in prices between buying and selling, and second, rebates being obtained from the suppliers. At some point it was decided that this was no longer appropriate, in particular because of the markup that SCCL was charging. So from 2019, there's a different system whereby the Department for Health and Social Care transfers directly money into SCCL to the tune of around £250 million a year. And that's called top slicing, because this funding comes from the budget of the NHS trusts. So somehow the department is withholding funds from the trusts and transferring them to SCCL in exchange for SCCL to sell at cost to the trusts. So the idea is that by front loading or top slicing the funding, what the trusts do is get 100% of the economic saving. So that markup is eliminated. Now, this has been very controversial in the run-up to the current situation for a few reasons, but the first one is that as of today, it's very difficult to know exactly what level of savings this system is creating. And therefore, for a trust, it's very difficult to understand whether the money that they have been withheld and that has been funding SCCL is commensurate to the savings. Ideally, what you would want is for the trust to be receiving savings in excess of the funding that has been withheld. Otherwise, it doesn't make sense. So it's controversial because it's not clear that this is happening, but it's also controversial because it creates a lock-in effect. So once the trust has has been forced to fund SCCL, the trust is very unlikely to want to go and procure things on their own directly from the market, even if the market could be giving better conditions than SCCL, simply because given the shortage of funding, the trust probably has to reduce its procurement capacity to make up for the shortfall. So it's a sort of a self-fulfilling prophecy where the more centralized the procurement is, the more centralized it's bound to become because the trusts are losing local capacity to procure. And this has been, for example, a massive problem in the context of the PPE, but we can discuss that later if it's of interest. Now, what I want to look at is how is this structure of funding, so central funding from the government to SCCL, that is carrying out a service that fundamentally is at the back office coordination of procurement structures, treated under EU law. And as I don't expect everybody to be familiar with EU law, but probably you all are. So if this is too basic or slow, please somebody raise your hand or say something. The key provisions to take into account are Articles 101 and 102, which is strictly on anti-competitive practices. And this would be important in this case because SCCL could be seen in particular to be put in a position such that they are a dominant market player, that they are a monopolist buyer of loads of supplies that are used by NHS hospitals. So Article 102 could potentially, on the abuse of a dominant position, be at play. More relevantly, Article 107 on the provision of state aid. And as you will know, member states in principle are prohibited from giving selective aid to a specific entity, except if they comply with a number of requirements. But in this specific case, probably the requirement would be for notification to the European Commission, and they would not be able to fund until the authorization was granted. But both sets of provisions, both the anti-competitive practices and the state aid rules, can be set aside for services of general economic interest on the basis of Article 106.2 of the treaty, and the exemption, the public service mission exemption, as Buendia has called it, is fundamentally for services of general economic interest which don't have to comply with the competition state aid rules, insofar as compliance with the rules obstruct the performance, either in law or in fact, of the particular tasks assigned to them. So somehow what's important is to start the analysis by the exemption to see if what SCCL is doing is actually a service of general economic interest, in which case state aid rules could be excluded, and failing that, then whether it complies with state aid rules. Again, to cut a bit of a long story short, in the interest of time, state aid for services of general economic interest are controlled mainly by Altmark, which is a case from 2003, where the Court of Justice designed 4 conditions for aid to not be caught by the state aid prohibition when it's given to a service of general economic interest. And those conditions are pretty straightforward in principle. The first one is that the receiver of the aid has to be under an obligation to discharge public service obligations, and that these public service obligations have to be clearly defined. The second one is that the parameters of the compensation have to be established before the compensation takes place, and they have to be designed in an objective and transparent manner. The third one is that the actual compensation must not exceed the costs of discharging the public service obligation plus a reasonable profit. And the fourth one is an alternative condition where the beneficiary of the aid has to either be chosen through a public procurement process, or if not, it has to be able to demonstrate that it is as efficient as we could call a notional efficient operator discharging the same obligations. So the 4 conditions basically come to say that there cannot be overcompensation and that there has to be an effective provision of a public service obligation. Now, the way out of this, I think, if a member state wants to try to avoid having to comply with the strictures of the Altmark test, is to either challenge that the entity receiving the fund is actually discharging a service of general economic interest and try to say that instead it's discharging a non-economic service of general interest, which by virtue of Article 2 of Protocol 26 of the Treaty on the Functioning of the EU would be outside of the EU competences. And there is now some support for this approach in a recent case, and I'm not going to try to pronounce the official name, but it was the TenderNet case about e-procurement platforms in the Netherlands. So that's one way out, trying to say this is not a service of general economic interest. It's something that is altogether outside of the treaties, which is a non-economic service of general interest. Or the other one is to challenge that the entity receiving the funds, the subsidy in this case, is an undertaking. And this could be done specifically in the context of procurement by saying that procurement is not an economic activity, and there is there's the strong precedent in FENIN, but also in SELEX, that procurement itself is not an economic activity, and therefore the entities carrying it out are not undertakings. Okay, so let's try to apply all of this to the example of the SCCL English supply chain manager. Now, even if this was after Brexit, given that state aid remains a sort of a battle horse in the negotiations, I'm guessing that the Department for Health wanted to run no risks, that this top slicing new model of funding that was to kick in on 1st of April 2019 would run into problems from an EULAW perspective. So they just published this letter of entrustment, which is searchable on the internet. And obviously, they just explicitly said that this letter serves the purposes of meeting all the requirements for an Article 1062 exemption from compliance with the EU rules. And it's clearly said, and I have highlighted it on the first page. However, it's not only that it has to be an explicit instrument, it's as we said, the first condition is that the obligation has to be clearly defined. And here is where I have some worries and some doubts, or let's just say openly, I just don't think the letter cuts it, because I just don't think that the letter defines a public service obligation that is sufficiently precise and clear. So basically what the letter says that SCCL is entrusted with the management and monitoring of the administration of the NHS supply chain in relation to NHS funded products and services. And it goes on to list a number of tasks that SCCL has to carry out, such as overseeing procurement, coordinating procurement, ensuring the provision of logistics, managing IT services. It's all back office activities. And here I have two questions. One is whether this is precise enough, given that there's no metrics or quality assurance mechanisms linked to it, even if there are later in the letter some key performance indicators for the assessment of the performance of SCCL. I just don't think that this is very clear. But even if it's very clear, I am not sure that these activities that are back office can be classified as the provision to the public of a service of general economic interest, because there's no interaction with the public whatsoever. And here is where there's maybe an issue of interpretation of Protocol 26 of the TFEU that we can discuss productively in the Q&A. But my initial answer is that it doesn't fit the model of the classical configuration of public service obligation. There is a direct provision of services to the citizens. The second issue, and this is by far clearly problematic, is the compensation model. So the letter itself says that the precise methodology for the allocation of funding is subject to consultation, and there is no detail on how the funding is going to be given or how it is to be used. So the second condition on the definition of the compensation mechanism to be prior to the compensation and also objective and transparent is clearly not met. And there is in the letter a clawback provision where some true-up exercise needs to be carried out at the end of every year to make sure the company is not retaining excessive funds. I really don't think that this clawback provision again cuts it, because this true-up exercise is completely undefined. So all in all, I think we have problems with both of the first conditions, and even with the clawback to avoid private, so excessive profits. So the issue then becomes, can we try to get out of all of these problems by simply going a higher level and saying, actually, well, SCCL, whatever the letter says, and that was a mistake, it's not a service of general economic interest, it's just something different. And I think we cannot do that. We cannot do that because it's hard to say that this is a service of general interest when it's, I think, clearly an economic activity. And it's an economic activity not only because there are other entities providing very similar services, particularly consultancies, companies doing that in the market, but also because this SCCL is not strictly limited to providing services for the NHS. They also take what they call non-acute customers, and non-acute customers include charities, GP surgeries, which are private operators in the UK, not-for-profit organizations, and also service providers to the NHS, so private companies that are further down the supply chain. So the moment that SCCL interacts with companies that are providing an economic activity, then at least that part of the procurement, under all the precedents that we have, should also be considered an economic activity. So just trying to bring the implications and to open up the discussion. What I think is that there is a very clear shortcoming in the letter of entrustment. I don't think it meets the requirements for an Altmark safe harbor to be triggered. Of course, this doesn't mean that there is a breach of state aid law. What this simply means is that we need to engage in analysis of state aid law. And it would be interesting to see the Commission look into that. But of course, in the context in which we're talking, that's just purely science fiction and it's not going to happen. But potentially there could be a stated case. Also, the competition law implications are unclear to me, but I think that SCCL sits in a very uncomfortable position from an Article 102 perspective, and they could be, basically accused of abuses of their market position, particularly in squeezing terms or in exclusionary terms, depending on how the procurements are run. But that's again something we can discuss. So in the end, what I think is that this case study shows that if it wants to go down the route of creating an SCCL-like structure or a privatized mechanism for the centralization of procurement, and they want to take the blueprint of the UK as a framework, they have to be very, very careful. First, in really upping up the design of the funding and the transparency of the funding to comply with the Altmark exemption, and failing that, just being very, very mindful of the market position of that entity. That was all I wanted to say. I know there's a lot of jargon and technicality, so I probably didn't make myself very clear. Happy to take any questions on clarification, but more importantly, happy to pick up your brains and thoughts on what's going on and whether this is relevant in your jurisdictions. Thank you for your attention.
Okay, thank you very much, Albert. I'm just going to stop recording now.